Okay, so the first thing I kind of wanted to ask you about was just about your individual practice. Like, what animals do you use? How do you feel like they're helpful? If you could talk a little bit about you individually using it, that'd be awesome.
Yeah. So what I do is I'm a behavior analyst. So I've been a BCBA for 10 years now, and I work primarily with kids with autism in a clinic setting in Nashville. And so I work with kids with autism, but I volunteer on the side with an organization that trains service dogs.
Okay.
So what I do, like I said, I hope I'm helpful in this, but what I do is my two worlds like kind of overlap there.
Right.
And like sometimes I have a dog with me at work, but I don't like structure my therapy sessions and I'm mostly doing supervision now at this point.
Right.
But even in the past, when I was doing like one-on-one work with clients, I never like structured my sessions to tailor it like to include the animal.
Right.
But sometimes it did work out in a way. Sorry, I don't know if you can hear that. We have like a thunderstorm right now.
Yeah, no worries.
And hey.
It's only fitting that the dog would be barking in the interview. Only fitting.
Daisy, come here. Sorry, she's like an 11-year-old bulldog. Come here.
No worries. My dog, my family's dog does the exact opposit, where she'll literally go in the shower and hide.
Yeah, some dogs do that. Yeah. She's scared. So I volunteer. So the dogs that I work with are actually the organization partners with the Tennessee Department of Corrections.
Okay.
So the dogs that I work with they live in a prison most of the time. And then I take them on the weekends, or sometimes during the week. But in the past, I've had them like at work with me, and I bring them to work, when I need to. But other than that, like I have them at my house, but also work with kids.
And do you see any kind of difference in your sessions where a dog's present versus a dog isn't? Is there a lot of interaction from the kids that you work with when you were doing less oversight and more one-on-one session?
Yeah, it depends on the kid.
Okay.
So I have like a wide variety, like, there's a saying, like, you've met one kid with autism, you've met one kid with autism. Right. So like their preferences, like it all just depends on the kid. So I have, I think 2 kids in the clinic that I work with or that I work at that like really are highly motivated to interact with dogs. So like we could use that as, something that they could earn when I'm working with them. It's a huge motivator for those 2. For another kid that I have, he likes to play fetch with the dogs. So like sometimes I'll let him play fetch with the dogs, and I'll kind of encourage language, like, requesting for the ball and then like telling the dog what to do. So we'll kind of get some more language in that way. But then I also have like kids that could care less about the dog. Like right. Really, I'm in the room and I have the dog with me and they don't really seem to care. But then I also have like one client that's afraid of dogs. So we kind of work on him, like just tolerating the dog being there. And like, I try to facilitate more like positive experiences with him for like dogs, because his parents would rather him not be so scared of dogs. So I use the dogs in that way with him, but it kind of just depends on the kid.
It's a lot of versatility. It sounds like literally it's fear of dogs, love of dogs, working on throwing fetch.
Yes, you can really do a lot with it.
Yeah, it really is a lot. I guess that kind of bleeds more into my questions, because I'm writing a lot, not specifically about the therapeutic use of dogs, but kind of dogs in the home, how that affects it. What are some helpful tips? And you may have really helpful information on that. So I guess what I'm wondering is, for building social skills, a lot of people say that having a dog in the house really helps a lot of kids who might struggle with social skills or interacting in public. Are there any activities, or whether it's playing fetch or using commands like sit, stay. Is there anything that you would recommend to help build some of those social skills with dogs in the home that you can think of?
I mean, in the home, like social skills, like facilitating language, like with the dog, for sure. You could have a kid like give the dog commands and things like that. But if you're wanting to target like social skills specifically, I mean, if you have a dog in the house, but you have someone coming over to the house, or you're taking your dog for a walk, like you could always use that as kind of a conversation starter, an icebreaker, if you will, like especially for like those higher functioning, like older kiddos that aren't really comfortable initiating conversations. Like a lot of people will come up to me and ask me about the dog. So that could be like an easier way to start conversations for them.
Right.
And, if they're well versed, in the dog and how the dog is trained and some fun facts about the dog, that could be like an easier way for them to interact. For sure. I could see that with like some kids, definitely.
That's actually a great idea. With the child that you have the negative experience with the dog, right, where it's really hard for them to be in the same room. Can you give me some of your tips on how you built that relationship? Because I'm sure there's a lot of families out there who have a dog, and then they have a kid, and the kid does not mesh well with the dog. How do you build that relationship to get rid of fear?
Yeah. So what I do with the kids is kind of the same thing I would do with a dog that's afraid of something. Like I would increase distance first. So like I would never make a dog or a kid like go up really close to that stimulus that's frightening them. Right. So I would increase distance, and then I would start like pairing that dog with things that are reinforcing to the kid. So whether the kid, likes a certain food or likes playing with a certain toy, I would have those available when the dog was present, so they could kind of know like, okay, when the dog is around, good things are going to come my way.
Right.
Basically. Yeah.
And then future steps from that, once you get past the far distance away, I don't know what stage you're currently at with that child that you work with that's scared of dogs, but what are the steps after that? Once you're able to be in the same room, what's the progress to petting the dog or cuddling the dog? Did you ever get there?
Yeah, I actually kind of let him, my goal, I told his parents, my goal with him is I just wanted him to be able to tolerate a dog being present without him yelling and running out of the room, which was happening in the beginning. Once I got the dog like in the room, I kind of just like let the dog stay in the room for a while. And I always kept the dog on leash just because that made him feel more at ease. But I just kind of let the kids see that the dog wasn't good. I think sometimes what kids are afraid of with dogs is like the fact that they can be unpredictable if they're really high energy, and they could like approach them really quickly. So I just kind of sat back with the dog and let him know that the dog was really calm, that the dog wasn't going to approach him, that there wasn't going to be any like barking or like erratic behavior from the dog. And then eventually he started talking to the dog. He's like asked me what the dog's name was, and I told him, and then he told the dog hi, and I just like made sure to like, reinforce and praise any interaction with the dog or about the dog. And he did like, once he got pretty comfortable, like I did ask him if he would pet him, and he has pet him a couple of times. He still doesn't like seek dogs out, and I don't know if it would generalize to other dogs. But he's doing a lot better. He doesn't like run screaming from the room anymore. So we've made progress there.
And I guess on the other end of the spectrum, would you do for the clients that you worked with that loved dogs, right? And you're in session and they only want to talk about that dog. They're only petting dogs. And you can extrapolate that to the home, right? Where a kid just can't let go of their dog. The dog needs to be everywhere. How do you help ease that and kind of shift attention away from the dog and onto other things?
Yeah. That's a tough one. That's one that I really haven't had to deal with a lot. In the clinic, my two kids that are really motivated for the dog are like, they're very familiar with ABA therapy, and they're very familiar with the contingency of like, first I'm going to do this task for you, and then I get to earn whatever. So they kind of know, like when I tell them and I set up that rule and that contingency, first we're going to do this and then you can have access to the dog. I would use that. I mean, like if a kid was really fixated, I would just tell them like, hey, first we're going to do this and then you can play with the dog.
Right.
But for a kid that doesn't want to be separated from a dog, I don't have a lot of experience with that. Because of like, so therapy dogs are a little bit different than service dogs. Therapy dogs are trained to go into a public place and kind of provide like emotional support, comfort for a variety of different people. So you see them in like hospital settings and nursing homes and things like that. But service dogs are trained to provide a service to one individual. So with the service dogs that I work with, I mean, they would always be with their person because they are like covered under the Americans with Disabilities Act. They can go in public anywhere. So that really would never be the case like with them. And there aren't a lot of those. A lot of our dogs don't go to individuals with autism. It's more like diabetic alert, seizure alert, things like that. But they have been a couple of times in the past where they have gone to individuals with autism.
Right.
So that wouldn't have ever been like something that needed to happen, I guess, because their dog would always be with them. So that wouldn't be a problem that they had run into.
Awesome. Well, I guess some of my last questions are just, and this doesn't have to be specific to children with autism, but you work with a variety of implementing dogs with a variety of people, I'm sure. And I just am curious, what are some of the common benefits that you see? And I know it probably ranges entirely differently based on who they're being given to, how they're being used. But if you could try to find a couple of common factors among all of the dogs, like whether it's happiness, whether it's comfort level, what are some of those things that you see in the clients that you work with?
Yeah, so I would definitely say comfort would be one. So whether it's a therapy dog or a service dog, like they just provide like a sense of calmness and comfort in like stressful situations. Like one of the dogs that I worked with, he didn't make it as a service dog, but he's now a therapy dog, but he works only in a dentist office for special needs patients. So he provides that like comfort in like a high anxiety, high stress situation, like going to the dentist. Kids, it's not always their favorite. So like I would definitely say like calmness for them, but then like also like flip side, for those individuals that get a service dog, like somebody with PTSD that is, or agoraphobia, who's afraid to leave their house, now can leave their house, I guess. So like calmness and maybe confidence too. Confidence to be able to leave their house, to be more independent. Same thing for like, younger individuals with diabetes. It helps them feel more independent and probably gives their parents like a little bit more like sense of calmness, knowing that their kid's going to be taken care of, even if their, blood sugars like get really low, that their dog will alert them and things like that. So like definitely calmness, confidence, independence.
Awesome. And then I guess this is not, you haven't done this, right? You made it clear that you work with dogs on this side and you work with kids with autism, ADHD on this side, right? And there's not a ton of overlap. If there was an overlap, and let's say you were centering your therapy around dogs, could you try and tell me what you think some of those benefits have been? If you have any colleagues that do that, some of the benefits that you see when behavioral therapy is given to kids with autism. Do you have any idea of what those impacts could be, positive or negative?
I mean, I think, again, it all depends on the kid. So I would really, if I was going to use a kid in a session, I would have to make sure that it really was a good fit for that kid. But I could see, if a kid had a certain set of motivations, if they really, enjoyed being around animals, but they, they didn't have as much language. you could definitely use a dog as a tool to get more language, because if the motivation is there and there's some cool things that this dog can do, you just have to give it the verbal commands. I think you could use that to increase spontaneous language, like not just giving the dog cues, but just talking to the dog, playing with the dog and things like that. So I think, the increasing requests, increasing, just it could be just interactions with the dog, or like I said, going around to other people and using that dog as like a icebreaker kind of, and facilitating conversations with other people, which could be kind of aversive for the individual, but with a dog there, it would make it a little bit more enjoyable for sure, especially if they're really motivated to talk about that dog.
Awesome. And then I think my last question for you is just, you mentioned the idea of a good fit, of like a child that would be a good fit. And I think when I'm going to be writing this piece, I'm very interested in what you think a child would be with a good fit. Which parent should seek out, in your opinion, some of that therapy service animal?
I mean, I think it would have to be a kid that, first of all, like showed interest in the dog and was motivated to interact with the dog at all. Because if you have a dog there and the kid just could really care less, you're not going to get very far. I mean, right. You could probably get further using like an iPad or their favorite toy or their favorite snack. So I would say, first of all, like, make it more motivating for the kid, like the kid would probably need that like interest initially. Other than that, it's hard to pinpoint, cause like I could see how I don't know. It's hard to pinpoint past that. I would just say like, bottom line, if they don't like dogs, don't push, any kind of therapy that involves animals, like unless it's done the right way and you're just working on like tolerating the dog, like in the case that I was talking about earlier.